It shows your phone number is not being muted, so I don't know.
Lynn, my best suggestion is for you to hang up and redial into the meeting. I'm sorry for the hassle. You're
No, your phone wasn't muted, Lynn. It's something else because your phone is showing as fine. It's your computer that's showing as muted, which is what we want.
no sound right now.
Try like *9, I think it is. On your phone.
On the phone, try *9, Lynn. Okay. Thanks, Lynn.
And this question, this is Eleni Yelorikis, APD AFH policy analyst. There's a question in the chat, and I think it would be best answered by Deb if she's still on. And Deb, if you'd like me to read this question to you, I'd be happy to do that.
Okay, can you hear me now? I was having audio trouble as well.
Yeah, now I can hear you now.
All right, great. Love our technology.
Okay, can you hear me right now?
We can hear you through your computer, yes.
I'm going to come back on the computer because my phone, the second I call in, it says, you're being muted. You're being muted. And for a while, I thought I was being muted by one of my colleagues, but now I think my phone is playing with me. So I will try this. And when that goes, we'll think of something else. I don't know, carrier pigeon. We'll try something different. Anyway, welcome back. And is there anyone who had questions right now after the break, who after thinking about what Deb was talking to us before? Any comments or thoughts before we get ready for the next step?
Yes, there is. And I was just, when you were having technology troubles, I was just asking Deb if she wanted me to read it to her.
I'm not seeing any hands or anything in chat. Lynette keeps waving at me. I don't know what I'm supposed to do.
You are not hearing us. You are not hearing us.
Can't hear you now.
Yes.
All right.
Oh, can you guys hear me?
Yes.
Okay, so Lynette, what am I supposed to be interpreting your signs as meaning?
You can't hear us.
She can't.
I can't hear all of you.
Mm-hmm.
Thank you for that. You're right. I had to then undo that. Heavens, this is silly. Thank you very much.
Can you hear us now?
I can indeed.
Okay.
Yes.
So
thank you so much.
Eleni is presenting a question from the chat.
Yes.
All right.
Yes. And if you could read that for me, Eleni, that would be terrific.
Of course. There's a question regarding the survey. APD serves mostly 65 and older. Why did the survey include 55 to 64-year-olds? Their needs can be dramatically different from a 65 plus person. There are not services available for housing or medical through our program. Shouldn't we look at the answers of people age 65 or older?
Yeah, good question. And that came up in the discussions with our survey advisory committee. And the primary reason for that was that there are people who are living with HIV, and there are some unique challenges for folks as they age who have or are HIV positive, and so wanting to address those issues with a slightly younger, if you will, population to be able to capture the specific needs of those folks, because many of them are similar to what we see as people age.
Any other questions about that?
And I would just add, a reminder that aging in people with disabilities isn't only like older adults, so that targeted population over age 65. We're also any adult over 18 with a physical disability. So, keeping that open keeps us with our target population as a whole, instead of focusing only on older adults. And Petronella put her hand up as well.
See that.
And I just want to add, if I can just add another piece to that. In our tribal communities, for programs that are funded through the Older Americans Act, for our federally recognized tribes, those Title VI programs. Those also Native Americans may be identified as being an elder at a younger age, depending upon the tribe and the program. And so there are actually folks who are in the 55 range who and older who are classified as elders. So we wanted to make sure we captured that as well.
Thank you. Petronella.
So just a quick question. Could we do a separate, surveys, one that is 65 and older and one is not? I'd be curious to see the difference in that. That was my only question.
And thank you. I would love to do, and I don't think I'm alone in this, love to do another survey. We hope to be able to repeat this survey over time. It is not without expense. So we'll have to work on that piece as well. But I would love to be able to do the survey again and then be able to stratify based on age.
Because I'd be curious to see what those results are. I'm in kind of the same with Donna. I'd be curious to see what's over, because there are different challenges over 65 in our adult care homes.
Other
Yes,
questions?
And I'm
Yeah.
sorry, I don't want to take
No.
up all the time on this, but there are also differences in the responses of people who are, if you will, younger, older, and older, based on of this population in particular, based on their life experiences, and in many cases, decades of discrimination. So the world looks a little bit different, if you will. That's a broad generalization, but it looks a little bit different now than it did when some of the folks that we're serving were, younger, in their 20s and 30s and so forth.
Okay. Other comments? Going to take just a minute here behind the scenes, and I apologize, but we've had one of our other documents isn't coming up. It's just not been a good day for us all around. But while we're doing that, I wanted to clarify something that perhaps wasn't clear earlier. The bill, Senate Bill 99, has already passed, right? That's law right now, and the governor has signed the law. And so what we are doing
Lynn, we lost your sound for just a moment. Also, I'm sharing my screen. Is this the document we're working with?
And
David
David,
can't
this
see
is
your screen.
Oh, you can't see my screen. Wow.
no.
No.
This is Eleni. I was also going to share that there was another question for Deb in the chat. And that question is, who got selected for the surveys and how were they selected for the survey?
So the survey went out, it was 2021, and folks were not going to, say, congregate sites. We were all still kind of at home. The survey went out primarily virtually, although there were possibilities and options for folks to respond to that on paper, by telephone. It was translated into 10 languages. People self-selected if they wanted to fill out the survey form itself and send that back in. So it wasn't that we selected people. The information went out across Oregon, and then people took the survey. Does that answer your question?
I see one more hand.
I am not seeing a response from them in the chat, so I think so. Oh, nope, she's asking another question. Sent at random? That's the question for the survey.
That's well, I don't know how to answer that exactly. It was sent out. We did press releases. It was sent out in email blasts from our partners and organizations, many of whom were listed on one of those initial slides. We disseminated the information as broadly as we could to be able to have it in front of, if you will, people who would be eligible to take the survey. So we just sort of blasted it out there. And fortunately, 1,400 people saw it and qualified and took it.
Fantastic.
Have an additional question?
We lost you, Lynn, but Kim has her hand up. I know you were calling on her, so I'll just jump in for you. Go ahead, Kim. Kim, you're muted.
There we go. How do these survey stats compare to like just normal, I don't even know if there's been a survey done, but the same issues in just a general over 60 or within the age group that you surveyed? How do they compare with just overall general population at that age as far as their stats with some of the same issues? Does that make sense?
Yeah, and as I was talking, we have some comparisons. We don't necessarily. I don't have all the numbers for every one of those findings that I went over, but in terms of like suicidal ideation, for example, I showed the difference there. Talked about the difference. The needs are, without getting into the specific data points and other data sources, the needs in general are higher. These are disparate findings, right? This is a population group with higher levels of needs, higher levels of discrimination, and when you take into account intersectionality, and by that I mean people who identify in more than one demographic group, if you will. They're both LGBTQ plus and people of color, women, et cetera. The rates are even higher. So it's clear that there are disparate effects for this particular population.
Okay, thank you for that.
Again, we're going to have Lynn's audio back in a moment. This is David, one of the staff supporting the process today. And Lynn, I can watch chat for a little direction here to keep our conversation going.
Can you hear
and you're
me
starting
at
to
all?
come back. Yep, you're
There you
starting
go.
to come back.
Okay, yeah, this is a particularly bad, and I think trying to poke the bear has made it go completely out on me, which is very frustrating. Okay, all right, what I am asking is that Kyle Rose can scroll through for us the different sections of the bill while I describe them. Kyle, are you able to make that a little larger? So we might have a better shot. And I don't know if people like the black background with white font, or you'd prefer it the other way around. It's, yeah, so I don't know. I probably would prefer it the other way, but maybe that's just me.
Okay.
I
Yeah,
find
can
a
change
little
that. That's just
harder
my
to
eyes,
read.
personally.
Okay, thank you. So if you can go ahead and do that, we will take, yeah, we'll take that.
I'm gonna
Now,
stop
what we're
sharing just for a moment while I do that.
okay, perfect. And I will just finish the comment that I was making before. So we've got a law in place. Senate Bill 99 was passed. And now what we as a state agency have to do is implement it by adopting administrative rules and procedures. So that's what we're starting to do today. And that's what we'll need a temporary rule in place again by January 1. That doesn't leave us enough time to do everything we have to do for permanent rulemaking by the 1st, which is why we're going to do a temporary rule, get something in place. Then we will move on and do the permanent rule and within 180 additional days. That's the legal requirement. So what we have then is the statute, which is the law, the statutory direction that the legislature is giving us. Then we are now going to be adopting the administrative rules that then will allow all of you to know exactly what you need to do in order to comply with the statute. So that's what you're being invited to be part of today. Are there any general questions about rulemaking and how that process can work? All right, hearing nothing, and I just want, if you can bump it up just a little bit more, Kyle, please, in size. I know a lot of people are going to have older eyes like mine, so I kind of go, there we go. That's big enough. Thank you very much. I really do appreciate that. So we're going to start with each section one at a time. All right. And what I've done is I've included in this document the most relevant sections of the language from the bill, but not all of the language is here. For example, the section 1 simply says where the law will live inside of all of our statutory direction. All right, that's all it does. Section 2, if you also look at your copy of the law, has 11 different definitions. And I've just summarized here, given the list without giving you all those definitions. They do include the definition of a care facility. And under this law, that applies to nursing facilities, residential care facilities, and adult foster homes. There is a definition of gender expression, gender identity, gender non-conforming, gender transition. In addition, we have harass or harassment, and then the actual definition of LGBTQIA2S+, of resident, sexual orientation, staff or staff person, and transgender. So what those definitions are set out right now in the statute. And what we will be doing, and what I've done below, is said comments and suggestions under that dear little blue line. LB, that's me, Lynn Beaton. I'm giving you the general ideas that we had as our program as we were looking at this. Right now, the department isn't proposing that we amend any of those definitions. Instead, we are proposing that we add them verbatim to every rule. So for example, they would be in the adult foster home rules, intact exactly as they are written right now in the statute. We can always add to those definitions, but we can't fundamentally change the meaning that's given to us in the statute. And because at Safety Oversight and Quality, the program that we're in, we don't have an overlying section of rules. Every rule section is individual to the facility type. So for example, for adult foster homes, you look at your 4 sections in the rule only, and all the language that's related to this bill will be in your own rules. Okay, just like residential care assisted living, theirs will all be in Division 54, and nursing facilities actually have 5 divisions, and their definitions will be found there. But what we're really going to be amending for your purposes are your adult foster home rules. And we know that at a minimum, we are suggesting that we include those definitions verbatim in your rule. Questions about that? And we can always come back and ask and talk about this again. For right now, let's scroll on down. I will also say that we went through this same exercise with our first group. So all the nursing facility and community-based care facility providers and advocates had an opportunity to give us feedback as well. And we were taking notes, which is what Kyle will be doing for us. When you do have comments or questions, he'll put that right on the screen so you can see how we're recording what you're telling us. And then after the meeting, I'm going to work with folks that were helping staff both of these initial racks. And we're then going to come back to you all at our next meeting, which again, combined meeting will be 9 to noon on Tuesday, November 7th. That's our next meeting date. And we will take all of your comments from today, and we will have draft rules for you to look at that meeting. But in this first meeting, we really wanted to be able to introduce the statute to you and talk about what we as the agency think we will be putting into rule in order to implement the statute. Any questions? What's the effective date of the statute? Well, the effective date in terms of what we have to have is January 1. So that's why that's our deadline for at least getting some of what's in the statute actually into rule. Yeah, thanks, Beth, for that question. Section 3 of the bill, or yeah, as we're looking at this, says that staff, this is a list of prohibitions. Okay, so this is a list of things that facilities or homes cannot do to residents because of the statute. So you are not going to be allowed to deny admission for LGBTQ plus reasons, or because someone might have the HIV virus status. All right. You may not deny request by a resident to choose the resident's roommate based on LGBTQ status. And as we go through this whole list, you're going to see it's they're fairly specific prohibitions. So what we're recommending at this point is that each one of these prohibitions, we include this whole section verbatim in our rule as well, just to be really clear that we know we're implementing the entire statute. This language is there as it is on the page right now and will then show up in each one of our 3 facility types. So they include if rooms are assigned by gender, assign, reassign, or refuse to assign a room to transgender, other LGBTQ plus resident. That's also prohibited, as is you prohibit a resident from using or harass a resident who seeks to use or does use a restroom that is available to other individuals of the same gender identity as the resident. That regardless of whether the resident is making a gender transition or is taking hormones, has undergone gender affirmation surgery, or presents as gender non-conforming. You may not repeatedly and willfully refuse to use a resident's chosen name or pronouns after being reasonably informed of the resident's chosen name or pronouns. F, you may not deny a resident the right to wear or be dressed in clothing, accessories, or cosmetics, or to engage in grooming practices that are permitted to any other resident. G, you may not restrict a resident's right to associate with other residents or with visitors, including the resident's right to consensual sexual relations or to display physical affection, unless the restriction is uniformly applied to all residents in a non-discriminatory manner. H, you may not deny or restrict medical or non-medical care that is appropriate to a resident's organs and bodily needs, or provide medical or non-medical care that to a similarly situated, reasonable person unduly demeans the resident's dignity or avoids or causes avoidable discomfort. Little I, you may not fail to accept a resident's verbal or written attestation of the resident's gender identity or require a resident to provide proof of the resident's gender identity using any form of identification. Little j, you may not fail to take reasonable actions within the care facility's control to prevent discrimination or harassment when the facility knows or should have known about the discrimination or harassment. And finally, little k, you may not refuse or willfully fail to provide any service, care, or reasonable accommodation to a resident or an applicant for services or care. Yes, and I'm
This
seeing.
is Eleni. I apologize.
Yes.
There is something in the chat as a
Yes.
follow-up. Would you like me to read that to you?
I think I'm saying, sorry, I meant what is the date when the statute's in effect and enforceable? I see the training section isn't required until July 2024. Are the rights contained in the statute in effect now? And I'm trying to remember if this was an emergency bill or not, because if it was an emergency bill, it went to an effect whenever that date was stated. Otherwise, the bill does go into effect on January 1st, but you are right. Different pieces of the bill are staged. So it's not an emergency. So it's effective January 1st, which is why we knew we wanted to have an not an emergency rule, but we needed to do it by emergency so that we would have this language in place and effective on the 1st. So that's why we're needing to do an emergency rule right now. But you are quite right. Facilities will not need to have completed the training until a later date, because the bill itself includes different dates as we go forward. Is that clear as mud? Okay. All right. Thank you. Perfect. Now, a statement that every facility will need to have is the following, and it's a verbatim statement that you're going to be required to put into your non-discrimination policy and share as a written piece of material. You can see it right there. You have to put your name of your facility, does not discriminate, and you can read through all this. We will include, again, this language verbatim in our administrative rules, and then you, as adult foster home providers, will need to then ensure that you have this statement that you posted. I think you're posting this one, but you're also being able to have it in your documentation for all residents, and you can provide it to residents upon request. So that statement will need to be adopted by every facility. Okay, so because this language is so specific under this section of the law, that's why we are recommending that both paragraphs 1, that list of prohibitions we just went through, and 2, which is this statement, both of them will be included again verbatim in our rule, and you will need to include them verbatim in your policies and procedures within your facilities. Questions about that? All right. If you can scroll down a little bit for me, Kyle. So, and that's just exactly what we've said. Oh, scroll back up for just a minute, please. I'm sorry. Thank you. And stop right there. Yeah, in addition to also putting the information immediately above on a poster that you can post, you'll also want translations of that poster if needed. And you should be able to provide that written statement to your residents. Also, just a heads up, once these rules are in effect, our surveyors who are then out on site visiting facilities doing licensing surveyors will be surveying to these requirements as well. Okay, so this is all information that you will be required to adopt and that we will then be surveying to ensure that everything is being done according to rule. I know this gets kind of intense, but just wanted to state all that right now so everyone was aware of what we're looking at. Okay, Kyle, thanks. Go on down. Will the non-discrimination policy go into the residency agreement? Yeah, I personally, and that's something we can talk about right now, is exactly where you put it. But yes, personally, I think it probably should go there as well as be in your procedures, be posted somewhere, and be able to be handed to facility or to your residents upon request. So because of that, it probably should. But again, that's something we're really talking about as we go forward. So Kyle, can you scroll back up, please, a little bit? And I'm going to ask you to put in right after mine. Yes, can you please put in, right there, return, and just say comment during the meeting. Have, so it's not just me, but just say during meeting, and then just have that question. So we will be sure to address it and capture that question when we're writing the rule. Will the non-discrimination policy go into the residency agreement? So good question. Thank you. And the last thing, Kyle, I'm going to ask you to do as we do each section, can you please, and I know this sounds petty, but to make sure that it doesn't look like it was a comment that I made, because I'm LB, if you can do a hard left for those, and just so it's during the meeting is what we did previously, so that if that makes sense. I don't know if that does. Just to be really sure that it's clear that these were comments made during the meeting. They were not comments that I was offering.
Sorry, what do you want me to type on the line?
Okay. What I would like, if you can make it clear and say during the meeting, and then below that even, so that it's like, just go flush left. Please, with during meeting, go flush left. Take what you just wrote and go to the left. Can you do that? So that just click right there and then go back to the left side. Does this not? There we go. And just keep going. So I want this under each section of the rule where people make comments. I just want it really clear that these are comments being made by participants. They're not comments being made by me, if that makes sense. All right.
Lynn, there's another question in the chat from Alyssa.
Oh, okay. Please go ahead and read it to me. I'm not seeing it right now.
Will the non-discrimination policy go into the residency agreement?
Okay, well, that's what we just talked about, right? So that was the question. And what I was just asking was that Kyle, if he goes back up a little bit, just to make sure we're all on the same page, literally before we keep, that's the exact question we just put into the comments right there.
My apologies.
That's all right. I'd rather be a little duplicative than miss something. That's totally fine. Kyle, let's move on, shall we? Scroll on down, please. Section 4. Now, I am the one who's bolded certain sections of the statute just to make it a little easier to get the ideas quickly. But when you look at the bill, there is not bolding like this in it. This is just something I put in. All right. This section 4 deals with resident records. And it's saying that, well, let's just read it. Paragraph 1, a care facility shall implement procedures regarding resident records generated at the time of admission and during the stay to ensure those records include the resident's gender identity and chosen name and pronouns as indicated by the resident. So that information will now need to go into your resident records. Also, care facilities are not allowed to disclose any personally identifiable information regarding a resident's sexual orientation, whether the resident is LGBTQ+, resident's gender transition status, or whether they have HIV. Those things cannot be shared by the federal or state law. Questions on any of that? Let's keep scrolling down to number 3, please, Kyle. All right. The care facility shall take appropriate steps to minimize the likelihood of inadvertent or accidental disclosure of information described above, and you cannot disclose it to other residents, visitors, or facility staff, except to the minimum extent necessary for staff to perform their duties. And you've got to get informed consent before any non-therapeutic examination or observation or treatment provided to any resident. Also, a transgender resident shall be provided access to any assessments, therapies, and treatments that are recommended by the resident's health care provider, including but not limited to transgender-related medical care, hormone therapy, and supportive counseling. So again, that's a lot of language and a lot of really requirements that'll now be on you as the adult foster home providers. This section does allow a little bit more flexibility for all of you, right? And it allows more flexibility as we write the rule. For the sections above, frankly, the department believes that, again, adopting them verbatim is going to be the best way and cleanest way to ensure that we are complying with state law. But for example, how do we minimize likelihood of inadvertent or accidental disclosures? That's not something they're defining here in statute. That's something we're going to want to try to spell out a little bit it more clearly in the rule to try to assist all of you in implementing this part of the law. So this is a section where I think there's some variability in how we write it. We have a little bit of latitude in writing the rule as we start. And then though, however, the department will be monitoring through survey to ensure compliance. And we do that now. We monitor your paperwork when we come on site as survey inspectors. And so this information would be monitored just like other required documentation is monitored through survey. Any questions? You're a quiet group. I was expecting lots of jabbering at me. So I will, that's cool. The last group only jabbered a bit, but I thought, ooh, this group will really be fun. I know, in a weird way, I really enjoy dialogue. So if you do have questions, now really is the time, unless this is just so overwhelming, you're all thinking, we just need a little bit of time to think about it first, which is completely fair and understandable. I've gone through statute now several times, obviously, but each time I'm like, okay, what are we going to do with that? So it's a dense bill. There's a lot in it, and it does take a time to work through it. I do understand. Well, hearing or seeing no other comments at this point, thank you, Kyle, for going to section 5. A care facility that violates the provisions of sections 2 to 8, or that employs a staff member who violates these provisions shall be subject to civil penalties or other administrative action as may be provided under ORS 441705 to 441745 and rules adopted by the department. And then these same sections may not be construed to limit the ability to bring any civil, criminal, or administrative action for conduct constituting a violation of any other provision of law. This section of the bill is causing pain for those of us with the state for this reason. They did list the citations right there for civil penalties for nursing facilities and residential care, but you do not see the statutes there for adult foster home. So I'm afraid that the drafters for legislative council who wrote the bill, they were probably moving quickly and maybe didn't realize. And I know that adult foster homes, I don't believe, well, I know you were not in the bill initially. I know you were added a little later, and I think the drafters didn't go back, review this section. So we're going to be recommending that we hopefully make that change at this upcoming session, legislative session, to correct that, to really put into the statute the ability for the department to regulate all 3 of the facility types. And this is an issue that was also raised early on by folks with Oregon Health Authority who have adult foster homes, and the folks from ODVS here in DHS who have adult foster homes. So we know this needs to be edited in order to be able to include all of you as well. Any questions about that? Okay. Hearing nothing, let's scroll on down to section 6. All right, continuing with my reading. So a care facility shall ensure administrators and staff employed by the facility receive training as part of the facility's pre-services or continuing education requirements. And caring for residents and living with humans with, or living with people with HIV, one of the required things that have to be addressed during the training, as are preventing discrimination based on a resident's sexual orientation, gender identity, gender expression, or HIV status. So every training will have to include those 2 things. And I'm going to stop for just a sec because I see that Deb has put something into the chat. Deb, could you tell us what this is, just so folks know what you're giving us here?
Yeah, I totally apologize. I noticed that I hadn't clicked send. It's the survey, it's the website where the survey and other materials are. I had typed in the chat, you can find them here, and then I didn't hit send. And so I apologize for breaking your flow there, Lynn.
Not a problem at all. We'll continue right on flowing
We're
away.
having a really fun technology day all around.
I will say this may be the worst meeting I've ever experienced for our technology, which is a major bummer. We were trying to make it be one of the smoothest, but yes, we are. Okay, so continuing then with section 6 of the bill, which is the training requirement. It's already stating above in number 1 what the training needs to include, but then below under 2, it says at a minimum, the training required must include the defined terms commonly associated with LGBTQ plus individuals and individuals with HIV. And again, those are those defined terms that were up in section 2 of the bill, those 11 different terms. So you'll have to be able to train your staff on those terms. And then the minimum training must include best practices for communicating with or about LGBTQ plus residents and residents living with HIV. The training at a minimum has to include a description of the health and social challenges historically experienced by these residents. And it has to include the strategies to create a safe and affirming environment for LGBTQ plus residents and residents living with HIV. So those are the requirements that have to be in the training. And what the department then under paragraph 3 is required to do is establish and rule the process that all of you will need to follow to provide that training. And we will be approving a training for you to have no later than 90 days after the date of request if a care facility requests a statement of the qualifications and training experience of an individual who will be providing the training, if the care facility submits the proposed methodology for the training, an outline of the training course, and copies of the material. So what's going to happen is you will need to ensure that your staff have the training. We're going to be working to ensure that there's at least one standard online training that you could use. But if you want to do the training yourself, this is what you will need to submit to us, the department, so that we can approve that training course. Are there questions about that? Okay, continuing on, please, Kyle. And the training must have the individual or entity providing it demonstrates a commitment to advancing quality care for LGBTQIA2S plus residents and residents living with HIV. Here is really one of the very first requirements in the bill that you as facilities and homes will need to put into place. You will need to designate 2 employees, one representing management at the facility and one who represents direct care staff. These people need to have received the training within 12 months of being designated and every 2 years thereafter. Those 2 individuals or employees will serve as the points of contact for your facility regarding compliance with the law. And those 2 people are responsible for developing a general training plan for your facility. The rest of it is in the event a designated employee ceases to be employed by the facility needs to designate someone else to do that. All right, scroll down, please, Kyle, to number 5. Then following that, so you've got your 2 people who are your experts then on your topic, right? Following that, it says, well, let me go to the question first. Does this language also apply to adult foster homes? Yes, it does, because care facility is defined up at the beginning of the bill. Care facility by law under this statute includes adult foster homes, in addition to nursing facilities and residential care. So I know that in your own rule, you're not always facilities and providers, and you use different terminology, but for this purpose, yes, adult foster homes under this statute are considered care facilities, just like the other two types being regulated. Does that help?
Yeah, thanks, Lynn. Can you hear me okay?
Yeah.
Yeah, this is Rachel with SEIU.
Yes.
My concern is around there are adult foster homes who aren't large, right? So having even one staff might not be the case. Does the language here, or do you expect that the OAR language will reflect that?
Will reflect what? That you might only have one person on what? Rephrase it, please, for me, Rachel. What exactly are you asking?
If you scroll back up to where it talks about having the language that you just read requires there to be multiple staff.
Correct. You have to have two people,
2 employees, right? So that might not even, it might just be one single person, right? Like
that's true.
So in that case, the assumption it would just be the one person.
Well, you're always going to have hopefully the owner operator. I mean, it's a management person on staff as well as maybe a second person, but you are correct. And I think, Frank, that's a good comment. In just a minute, I'll ask Kyle to put that down into the notes section. If you only have one person on staff, then yes, you are your own designated expert on this topic, and you will be training yourself. But yeah, good comment. That's helpful. Stephen Esser, do you have a question? Go ahead. It looks like you do. Please ask.
I do, thanks. So related to that, but back up to the department approving the training suggestion. I think it's number 3A, the care facility submits. Then capital A is a statement of the qualifications and training experience of the individual or entity providing the training. Are there going to be standards of what qualifies someone, and will that be spelled out? It'll need to be spelled out, I guess, by January 1st of what experience is adequate to be able to be considered a knowledgeable trainer.
We definitely will need to spell that out in the final rule. The only benefit maybe to having to put some things into place by January 1, we might not have all the language perfectly hammered out then, which is why we're going to turn around and immediately keep going with a permanent rulemaking. That's why hopefully this group will continue to meet for the next 4 or 5 months. So I'm hoping that we have all the language in place as part of the temporary rule on January 1, but I doubt it. And I'm personally expecting this kind of information. We might still be trying to work it out as we put that language into the rules. But yes, I agree. We will definitely need to spell out exactly what that training would look like, or those qualifications would look like in rule, to give you folks some idea of really who would be qualified to develop and provide this kind of a training. Do you anticipate that Oregon Care Partners will be an entity that will provide this training for free? Yes. Yes, we do. So that's where we are hoping that we will have a training ready for you. If you want, I like the smiley face, that's cute. If you want something on the shelf that you can take and use intact, that's exactly what we're hoping to do. But for those who want to design your own training, now you know under this whole section of the law, that's what you need to use, spell out, and it will need to come to us to be approved. But yes, we plan to have one that you can use for free. Yeah. Any other questions on this section? Okay, then Kyle, can you please scroll down and right to there, to section 5. Okay, where is the section? Well, this one, within 12, okay. Anytime you then hire some new person, they have to complete this training as well. And training provided subsequent to initial training must include at a minimum refresher courses on the topics described above. Okay. Again, I don't know if with Oregon Care Partners we'll only have a single training, or if we might do refresher trainings there that you could use subsequently. But you'll need to keep refreshing every year and providing additional training to ensure your staff stay aware and up to speed on all of these requirements. Then, as stated in paragraph 6, you will retain records like you do for all your other trainings, documenting the completion of the trainings. And then those records will be made available upon request, either to us when we're doing survey or at other times, or to the long-term care ombudsman. Keep scrolling down, please. All right, a care facility is responsible under paragraph 7 for the cost of providing the training required by this section. So if you decide you want to design your own, you will bear that cost. Again, our hope is that the Oregon Care Partners training would provide you a free option to hopefully make that less or more cost effective to you, and you wouldn't have that cost burden. That's the hope. So Kyle, could you please do another thank you, perfect. During the meeting, yep, right, perfect. Might only be one staff person or employee, perfect. Good memory. And so that might end up giving you a, we might end up saying for adult foster homes, if you only have one staff person actually helping out or working at the facility, you would only need to have one person trained to do that. So thank you for that question earlier. And will the standards be set? Yes, they will. Thank you. Good questions. Any other questions on this training section in terms of what the process will be, at least very generally? We'll be spelling out the details in rule, but I want to make sure everyone at least is aware of what's in the statute. All right, Kyle, go ahead and keep on scrolling down, please. So any entity that contracts with you to provide services or supports directly to residents also needs to have completed this training. Okay. And they shall provide the training within 12 months of entering. What did I do there? Oh, of your contract. That's right. With the care facility, and every 2 years thereafter. Yeah, I'm, to be honest, not sure. Well, the 2 years requirement for training, that's a new one, at least across most of our settings, because normally it's an annual refresher training, right? This one might not be, and that could be an issue for us, just because it'll be very hard for you to keep track potentially of exactly which training is required where, but we will be spelling that out too in administrative rule as we start that process. Okay. I think I see what happened was that it got, okay. Okay, so basically it's saying below, paragraph 2 is buried, unfortunately, in the middle of section 7, that paragraph. So it says that anyone who contracts with a facility or provides direct support to your resident shall complete that training no later than 12 months, so 1 year after entering into a contract with a facility, and then every 2 years thereafter, if that makes sense. Stephen, question.
Yeah, so to clarify what this section is getting at, this includes like home health, hospice, those types of agencies coming in, excuse me. And so then I guess that would just be governed by whatever authority is governing those agencies to verify that they're doing that, or is there going to be a requirement that the foster provider is ensuring that that training's happening? It's a little adjacent.
That's a really good question, and I don't think it's really clear in the statute, but I think frankly what we, the state, would be doing to implement this is to come back to you as the provider and say, can you give us evidence that these contractors completed the training? And we've talked a little bit about that internally. I'm not sure what that would look like, but right now that would be my response.
So I also want to add, I do think there is a difference, though, between an outside entity that contracts with an adult foster home and an agency that comes in and provides additional care. Home health isn't necessarily contracting with the adult foster home. They're providing care to an individual. So I think that as we're looking at this closer and writing that rule, we need to be careful about those, keeping those separate, because in my mind, the way this reads to me is that they're specifically contracting with the home. So say my nurse RN, that I've hired for the home, they would need to have that training. But if hospice is providing care for a resident, they're not necessarily contracted with me as a provider.
Very good distinction. Thank you. Thanks for making that clarification. Okay. Any other questions on that specifically? Then let's scroll down a little bit to paragraph 3. Training again provided subsequent to the initial training of an individual or staff person must include at a minimum the refresher courses on topics listed above, right? And then finally, the contracting individual or entity shall bear the cost of the training to their own workers. I think, yeah, I do agree with Lynette's distinction. That seems like a good clarification. And thank you for putting, into the chat. So is there going to be a requirement that the foster home provider is ensuring training is happening? Again, we, the state, will need some way of knowing that, and that would be coming to you folks. So if they really do contract with you directly, like the RN consultant example that Lynette just gave, we're going to have to decide, are we going to write into the rule, you're going to need to ask them for a piece of paper. They're going to have to document it as well. So we will need to figure out and clarify in the rule exactly what your role will be in ensuring that they've completed the training. Okay. Thank you, Kyle. Difference between contracted, hospice home. Yep, very good clarification. Petronella.
Just real quick, is the department going to be doing any trainings on this? I know, Lynette, you have this show on the road. I don't know if this is going to be doing anything like that.
It is something that we are definitely considering. We definitely want to support this. I mean, let's be real. We have over 1,300 APD adult foster homes. I don't want to approve 1,300 trainings. So we want to do as much as we can to support this effort. I think for us, I just want to be mindful of how the trainings are being created, making sure that we have, express kind of approval and input from the community that we're addressing so that we're voicing their concerns correctly, and just making sure that we're speaking for them and not in place of them. So whatever we can do to make sure that we are executing it properly and in honoring this population, I am happy to do that. And I think it's important that we do.
Okay. Yeah, we'll definitely take it on with the association, but I was wondering if the agency was going to do anything.
Sure.
Right.
Yeah, it's definitely on our list, Petronella.
Thank you.
You bet.
Thanks for the question. Good question. Let's scroll down a little bit, please, to section 8. This one's short, but could end up being at least a little bit challenging to implement. Any requirement above may not be applied to a care facility if the requirement is incompatible with one, the professionally reasonable clinical judgment of the management or staff of the care facility, or 2, a state or federal statute, federal regulation, or administrative rule that applies to the care facility. Paragraph 2 looks fairly straightforward. At least we think we can interpret it reasonably. Paragraph 1 is language that was used by at least 2 other states in looking at a similar law. That phrase of using if your facility were to use your professionally reasonable clinical judgment of the management or staff. But we will need to define in rule exactly what that's going to mean, because right now we don't know exactly, although other states are also currently going forward with implementing language, and we'll certainly look at how they've decided to interpret it to see if it might be applicable here in Oregon as well, or how folks here would want to potentially interpret it for Oregon. Questions about that phrase? Okay. Moving on then, please, Kyle. And actually, I'm thinking right now, this is a lot of listening to me just read at you. And if the folks on the call, particularly who are working with me behind scenes, would it be a good idea to take a second 10-minute break? I think it might. I don't think we're going to run out of time because we're getting through the bill in pretty good speed. So I'm thinking that right now we're going to take a break and come back at 10 after. So thank you.